Good evening, everyone. Thank you so much for joining us, and thanks to our generous benefactor sponsor, Mitsubishi Tanabe Pharma America. The program will begin in 2 minutes. Back real soon. Good evening, and thank you for joining us tonight for Ask Me, our educational webinar series sponsored by Mitsubishi Tanabe Pharma America. My name is Audra Hines, and I'm Vice President of Care Services for the ALS Association Golden West Chapter. The chapter offers a range of online programmatic and support group options, with more than 30 support groups offered each month, as well as a library of webinars like this one you're participating in tonight. There's great information and support for everyone. The chapter's 18 care managers are always available to work with you individually to locate community resources, help with benefits, provide guidance around durable medical equipment and other supportive services. Additionally, we offer an extensive equipment loan program that includes a range of durable medical equipment as well as adaptive communication devices. If you'd like to learn more about our programs and to support the chapter, please visit our website at www.alsagoldenwest.org. Tonight, we're proud to host this special program on navigating swallowing and dysphagia issues while living with ALS. This webinar is being recorded for later viewing on any of the Golden West chapter's social media channels. Our guest speakers this evening are Naomi Weiss and Heather Thompson, speech-language pathologists from Cedars-Sinai ALS Clinic. Please join me in welcoming Naomi and Heather. How are you both this evening?
Great, how are you?
Doing wonderfully, thank you. So I will go ahead and hand the presentation over to you both.
Hello, thank you all for inviting myself and Heather to speak to you and hopefully give some information, answer some questions you might have, specifically with swallowing and dysphagia. So my first question, I guess this is the next slide. What is dysphagia? Waiting for the slide to change. So dysphagia is difficulty swallowing foods or liquids, and in the ALS population, it is a result of weakened muscles in the oral cavity, tongues, lips, throat. So when you think of eating, you think of the tongue having muscle moving the mouth. You get the food in your mouth, you have to chew it up, push it back, and then get the strength to swallow it down. So if there's an issue with the tongue, with the lips, with the jaw, any of these things, then you can have some difficulty getting the food to the back of the throat. When there's throat muscles that become weak, you can have trouble getting it down to your stomach. And sometimes in the stomach area, it can come back up, or it just, again, those muscles get weak. Next slide. Okay. So some common signs of dysphagia: coughing or choking, increased time when we eat a meal, weight loss, eating less due to fatigue, and feeling food sticking in your throat. So when you think, I don't have an issue, I'm totally fine eating, and you eat your meal, and when you used to eat a whole, let's say, bowl of spaghetti, went down 15, 20 minutes, you ate it, you were full, life was good. Now you might notice you're, I'm eating for 10 minutes, I've eaten half my food, I'm not really so hungry, my tongue's a little tired, my mouth's tired, I'm done. So that can be an initial sign that things are weakening, or the muscles are changing. And with that, you can start the weight loss. So those are things just to kind of keep in mind. And again, more common signs of dysphagia. Onto the next slide. Again, this is kind of just reinstating what I just said. So there's choking, coughing, vomiting food is one that, if there's reflux, having a weak voice, a weak cough isn't necessarily a sign of dysphagia, but it can impact your safety when swallowing, excess saliva and drooling. So if you have a lot of drooling and saliva, then it's going to make it hard to get all the food together and push it back to your throat and swallow it safely. Next slide. So this is feeding tube, when and why. And I know that this comes up a lot. A lot of patients do ask this. When do I get a feeding tube? Why should I get a feeding tube? What's the purpose? So the purpose of it is to maintain your nutrition and your hydration. Let's say you can do that on your own. Great. Research has shown that early placement of the feeding tube shows better long-term life and outcomes. So there was a study that looked, and it actually showed that patients with ALS lived 6 months longer. And there was another one that had a 9.5-month lifespan with early placement. So early placement, I don't know exactly the numbers, but I know that the ideal is if there's a loss of greater than 10% of your body weight, that's the time when one should be thinking and getting a feeding tube. Something that I find to be very important that people don't often think about is feeding tube does not mean I can no longer eat. Feeding tube means I'm going to eat what I want that's safe for me, and if I can't eat enough of it, I'm then going to supplement with some nutrition and hydration. It means I'm going to enjoy the food that I can, but not worry about the weight loss and the malnutrition or dehydration. So I think that that's an important thing to know, is that it's not all or nothing. It's not I only can eat or I can only eat with the feeding tube. It can also, for some, be the difference between changing a diet, which we'll get to in a few slides, of it's so hard to eat my whole meal, I'm losing weight, now I'm going to just change to a puree diet, and I'll get to that in a little bit. So in order to get my nutrition, I need to have a puree diet. So it can take away from that stress as well. Instead of only having a modified diet, I can now eat whatever I want and use the feeding tube. So it's good to know this. Now on to modified diets. What is a modified diet? You can switch slides. So there's I would say 3 main categories. There's regular foods, which are the foods you're probably eating every day. Pizza, chicken, meat, potatoes, just prepared food. Soft solids are another category, which is cooked fruits and vegetables, cooked pastas, overcooked rice, fish, and then there's something called puree, which is blended food. If you think about the way smoothies are, shakes are, baby food, applesauce, and yogurts. And we have this nice little picture. Wine is not a puree, but I kind of like this picture. So we can go on to the next slide. Same thing with modified diets with liquids. You have thin liquids. If you've heard of nectar or honey thick liquids, the pictures here have to do with how one would thicken a liquid should you have difficulty. So let's say you're coughing on, you're having some of these symptoms, you're fatiguing, getting that food down, there's a little bit of weight loss, it's taking longer to eat meals, and that hamburger is just not doing the thing. So your speech therapist might say, let's switch to soft foods, which means your fish, your pasta, your cooked fruits and vegetables. And you're also having some coughing when you're drinking. So that might be time to think about thickened liquids, putting a little bit of powder or gel. There's different ones. The thicken up is more of a powder. The Simply Thick is the gel. And then you can buy pre-thickened liquids, which is that third picture down here. Some of them are sold in CVS, Walgreens. You can get them online. In addition to this, before the diet changes, more often than not, a speech therapist would recommend something called a video swallow study. So what that does is it looks at the inside of the swallowing. So it's an x-ray where they put some white looking paste. Some people may have already had this done already. And they put it on different foods and they see, how is the tongue moving? Is it slow? Is it pushing the food back? Is there food sticking in the mouth at all? Then when it goes down the throat, is it sticking anywhere in your throat? Is it going down the wrong way? So is it going down in the area of the lungs where it's supposed to be going down towards the stomach into your, down your esophagus, down to your stomach? In which case a therapist, a speech pathologist would say, okay, let's change it. It's not safe. So in thinking of, and I wonder if anyone's had this, when they've had a swallow study done, people like to say you pass or you don't pass. We like to say it's certain things are safer, certain things aren't safe. And this went down one way, then you coughed it up. So things that might put someone at an increased risk and need for changing a diet would be if they say your cough is weak, so you can't cough very strong, and a food went down the wrong way, so it went in the area of your vocal cords down towards your airway, towards your trachea, and then when you cough, it was too weak to cough up to protect your lungs and your airway. And so if you modify your diet, it gives you a little more time and it gives the muscles some leeway to be a little slower and a little weaker while still swallowing safely. Moving on to the next slide is talking a little more about safe swallowing strategies. Do not eat like that. Not ideal ever. So things that are important, if you start to notice anything changing, you can say to yourself, okay, do I eat quickly? Let me slow that down. Am I putting lots of food in my mouth at once? Let me take a small bite. I feel food sticking. Maybe I should drink a little bit and see if that helps wash it down my throat. Another thing that's important is always make sure you're sitting upright when you're eating or drinking. So don't lay down. It's nice to lay down in bed, not ideal. And then to continue on with more safe swallow strategies, or these are more of, I would say, things that can compensate when there's muscle weakness. So if the muscles of your lips are still great and strong, a straw can be helpful. if you're having trouble getting a liquid to your mouth, someone can do that, and you can help by just putting your lips on the straw and drinking from a straw. A cup with a spouted lid is another one, but again, you have to have good lip strength to keep your lips around it, to suck on it. Something that recently occurred to me was a cup called the Miracle 360 cup. So it's the one in the top right that's blue and green, and it's a company called Munchkin. It is made for kids, and what it does is it's spill proof. The top of it is such that when you put your lips on it, you can either use your teeth or your lips as a little bit of pressure, and when it's tilted backwards, some of the liquid comes out. So you're able to control it without needing too much lip strength. And if it's someone who's helping you eat, it prevents them from giving you too much liquid at once, because that can also become a problem, is when you're dependent on somebody else to help you eat, you have to make sure that the communication is good, that someone is not giving you food too quickly, that there's not too much going in. And that's really hard when you're not able to control it yourself. Also, the brain kind of automatically, this, what we call like oral, part of the oral preparatory phase is preparing the food. So getting it in your hand toward your mouth, your brain is already telling your mouth what it wants to be doing. So some of that signal can get lost when someone else is feeding you. So these are just some things that are helpful and important to know. A slide that I did not put on, but I would like to touch on, which I think is very important, is oral hygiene and making sure that people have, that there are regular dental visits, that we're cleaning our mouths daily, brushing your teeth before and after meals, and if there's a suction that's needed, using a suction. There are toothbrushes that have attachments for suctioning. The reason for this is, and this is with a feeding tube or without a feeding tube, obviously if there's food in your mouth and it's stuck in your mouth and it goes into your lungs, it can cause pneumonia. However, even when you're not eating and you just have a feeding tube, your mouth can get very dry, and bacteria loves to grow in dark and warm places, and you can aspirate on that saliva. So regardless of whether you are eating all day, not eating at all, or doing a mix of a feeding tube and eating, it's important to always have good oral hygiene. Keep your mouth nice and clean, go to the dentist regularly, and if there's any issues with jaw opening or making sure that the saliva or the whatever comes out, there's various things like suctioning that can be done to help with this. So I know that was kind of, I hope it addressed some of the things, and I look forward to answering some questions right now, because I'm sure people have a lot of them.
Thank you so much, Naomi. I absolutely learned some things there. So I think it was probably helpful for everybody who's listening. We had some questions submitted during the registration process. So I'll ask both you and Heather these. You guys can figure out the who's who and who answers what. I'll start with actually a live question that we have. Does dysphagia usually happen before breathing troubles, or does it vary by individual?
Naomi, I can take this one, but will you do a favor for me? Will you go back to the first slide that you had? If there's a way to show that. I saw that question, and I feel like it's a great question, and the way to really look at this is knowing the anatomy. So was it dysphagia slide that Naomi has? She's getting it up for us. To me, breathing and swallowing go hand in hand. If you can't breathe, you can't swallow. So if you look on Naomi's picture right here, there's this flap called the epiglottis. And that flap, when you swallow, goes down and closes off your airway. So essentially, when you're swallowing, you're not breathing. So those strategies that Naomi was talking about, going slow, taking your time, that's where these really come into place. So if you're a fast eater and you're eating quickly and you're not giving that flap enough time to come open so you can catch your breath, that's when you're going to notice more coughing and choking and with eating. So does it vary a little from person to person? Yes, I would say, because the slower eaters can usually compensate for that because they're used to eating slow and tasting their food and taking their time. But the people like me, unfortunately, who eat quickly and can, take a bite of pizza and the whole thing's gone, that's where it becomes important to slow down. So I always tell my patients, remember, if you're not breathing, you're not swallowing. You've got to breathe to swallow. And the main reason is because of that little flap is closing off your airway when you are swallowing. So you have to be careful to make sure you're coordinating your breath and getting enough breath.
Okay, great. And then just a clarifier from the same individual, she says her question is, does it happen earlier in the progression of the disease, not earlier in the swallowing breathing process? So
I think that depends on where the onset of the disease is. If it's a respiratory onset, it usually happens earlier. Upper motor neuron onset or a bulbar onset where speech is involved, it's earlier. But if it's lower motor neuron, it could be later on down the road, even if at all. So.
Gotcha. That makes sense. Thank you. Thank you for clarifying that. Some questions we got in the kind of early registration process. How can you tell if a person is aspirating while eating?
Can I take this question?
Yeah.
So I'm not sure you can fully tell if someone is aspirating. I would say the gold standard for finding out if someone is aspirating meaning fully going down into their lungs, would be to do a video swallow study, which is done in the radiology suite. The signs and symptoms that were kind of mentioned before about coughing, choking, if someone has a very wet voice, those can be some signs that, yeah, maybe I should have this looked at. Maybe there's something going on.
Sure. Okay. Great. Thank you. Couple of people asking a similar question, asking you to, if you could speak about laryngospasm. Am I saying that right? Okay. How to avoid it, how to treat it, and how dangerous can it be? This person's saying, my secretions are so sticky, sometimes I feel like my vocal cords stick together and my epiglottis sticks down in a closed position and I have to cough to release it.
So, Heather, or should I speak for it?
I'll let you start and then I'll jump in and after if there's anything I have to add.
Great.
Okay, so those are kind of, I would say, two separate questions, one with the mucus and one with the spasm. So in regards to the spasm, you can definitely start with some reflux precautions. So if needed, any type of medication and sitting upright when eating, and then after eating as well for an hour, 30 minutes at least minimum. And there is something that can be tried. I don't know if it will work, but it has been recommended. So what you do is you take 2 sniffs and then you do some pursed lip breathing. So, and you can do it, it's good to do it during the day when you're not having a spasm to kind of train the body out of it. Hopefully that can help a little bit. I think the idea is that it is a spasm, so it kind of comes on its own. But the idea is by doing the sniff, snip, pursed breathing and doing it throughout the day, you're retraining your body to work through it and to hopefully not end up in a spasm.
Gotcha. Heather, anything you wanted to add?
Well, I have nothing to add other than to, like, if you feel like you are going through and you are having those spasms, a lot of times what patients will say is they'll stiffen up and it makes it worse. And so then cueing back in to remember, like, if you do start to have that spasm, to remember what Naomi had said with the sniff, sniff, breathe, and try to kind of control your breathing that way. And people have seen some success with that, with controlling the spasm as well.
Okay, great.
In
That's
those
great.
times of anxiety.
God, for sure. Right.
Because it is anxious feeling when you feel like you cannot breathe. But if you can, and two, that's the other thing too, doing it when you're not in a spasm, I feel like helps. I don't know if it makes it better, but I feel like people know what to do if their body goes into that spasm.
Great, and this question may sort of relate to that. I'd like to keep my swallowing muscles in shape as long as possible. Is there any reason I shouldn't do swallowing exercises?
I'll take this one. I would say if you feel like it's helping, do it. I would be mindful, and Heather, you can jump in also, to making sure to not fatigue the muscles too much. If you overwork the muscles, you can make them tired. Heather, do you have anything to comment on that?
Yeah, I agree with Naomi on this one. The other thing is too, the best exercise for swallowing is swallowing, in my opinion, eating and drinking. So if you want to eat and drink, I always tell my patients, eat and drink. That's the best exercise you're ever going to get for your swallowing, versus doing all of these other exercises that could fatigue you, and then you don't get your nutritional needs. So just in any kind of diagnosis, I'm very much of the philosophy, if you want to practice swallowing, then eat.
Gotcha. Okay. One person says, it's difficult to swallow liquids, but I enjoy drinking water by mouth. Is it safe to keep drinking even though it causes choking? Will there be a time when it'll be difficult to swallow saliva?
Yeah, that's a big question. So starting with, I like to drink water. I don't know if I should be conservative or not with this. My rule of thumb is, there's a balance, I would say, in general with quality of life to start, with everything, with eating and drinking and how we choose to eat and drink. There's ways where if you perform good oral hygiene, then you can, let's say, drink some thin liquids, water in isolation. So what that means is if someone is coughing with water or liquids during a meal, then the recommendation, and we call this like a free water protocol, the recommendation is in between meals, when you're not eating or taking medication, to make sure you have good oral hygiene, brush your teeth, and then you can sip on some water. It's probably, if someone thinks they're choking and it's water during meals, it would require a good looking at, or seeing, at least if I have a nectar or a little bit of a thickened liquid, do I stop coughing? At least that would give you some type of immediate idea. I mean, if there's coughing, it could be in the lungs, it could make you sick, it can cause pneumonia. So obviously you want to avoid that. But I think the balance is hard of what we want and what is safe, and just understanding the risks and how to be the most safe, and kind of have our cake and eat it too. In regards to saliva management, does it mean it might get harder to manage saliva? That was the question, correct?
Correct. Yeah.
Good. When? I don't know if anyone could tell you that. A similar timeline is, everything changes for everybody at a different rate. Right. Could it happen? Yes. Will it happen immediately? I don't know.
Okay. Would using a pill crusher ease the swallowing process of a smoothie, of putting it, into?
I mean, putting a crushed pill in a smoothie?
I think that, from what I'm understanding here, instead of just putting the pill into the smoothie, maybe crushing it up instead.
Well, if there's trouble swallowing a pill
Mm-hmm.
and they're putting it in, let's say, an applesauce, and that's still hard, I would say
Mhm.
if it's a pill that can be crushed, which
Yeah.
always, like, I believe with the doctor, with the pharmacist, to
For
see
sure.
if it can be crushed.
Mm-hmm.
Also, in discussing with doctors, depending on what the medication is, there are sometimes liquid forms of medications
Mm-hmm.
that might make it easier. But if it's a pill that can be crushed and you can crush it and put it in a smoothie, I don't see why that would be a problem.
Gotcha. Okay. This is an important question. Talk a little bit about best practices for handling choking, especially on liquids, thickened or thin, sort of prevention and procedures, potentially.
Preventions. Again, yeah, Heather, you want to chime in?
Well, I was going to say, I think it's where it's really, if you start to, and I think Naomi, if she didn't mention it, I'm going to jump in. I think this is where it really, getting your speech therapist in and getting your speech therapist in early before you have a problem is where it's important, because our goal is to stay one step ahead of everything. So if we're seeing you before you have a problem, we can gauge to prevent the choking incidents. I always guide my patients, first aid. I encourage family members to take a first aid class, know CPR, know the Heimlich maneuver. Yeah. The thing of it is with choking, it's scarier for the caregiver than for the patient. It's scarier for them because as a patient, you know what's going on. Mm-hmm. You know that you're coughing, you know that you're choking, you know that that's going on, but it's the caregivers around you that are very fearful. But I definitely endorse, first aid, CPR and the Heimlich. But then too, I always encourage, and even in the clinic, Naomi and I are in, we tell our coordinator, even if they don't have a problem, we want to see them within that first 3 to 6 months of diagnosis, because we don't want the choking to happen. If you start having problems with water, then we want to move you to the nectar thick liquid. If you're starting to cough, we want to put you in that video. So I don't know if I talked around it, but as much as this is kind of where the importance of being linked in with your speech therapist comes into play.
Absolutely. And a little bit related to that, how will I know if my loved one cannot eat by mouth any longer? Important question.
I don't think it happens overnight. I'll start there. I don't think anyone's going to wake up and all of a sudden you can't eat. I think it's a gradual process. It will be clear. I would say it might start to take longer to eat. Food might get stuck. Someone might say, you know what, I can't eat that anymore. It's just too hard. I'm getting too tired. You'll notice the coughing. And like Heather said, again, it's important to always have a speech therapist involved. But I think what's most important is just that it doesn't happen overnight, and understanding what some of these subtle signs and symptoms are that I believe I touched on in one of the first couple slides of it's taking longer to eat. I'm not eating as much. I'm having some loss. Those can all be quick red flags of, you know what, I think we need to look into this. You are eating, but it's not the same as it was. So let's see what's happening.
Okay. Wonderful. Thank you. That's very helpful. One woman says, my screen froze when Naomi was discussing why it was good to get a feeding tube earlier than later. Can she briefly go over this again?
Sure. One, it's good to stay, as Heather mentioned recently, we like to stay ahead of things. So staying ahead of the nutrition and hydration before it becomes problematic, which I don't think I actually mentioned before. Also, some research was done, a few different research studies showing that earlier placement actually shows a longer life expectancy. One study was 6 months longer, another one was 9.5 months longer. And again, you don't want it to end up in a situation where there's malnutrition and dehydration, and it becomes this urgent matter. As Heather pointed out earlier as well, that if you can't breathe, you can't eat. So if you start to notice that breathing becomes difficult, you can end up in a situation that might make it a little dangerous to do the procedure to begin. You want to make sure that that is also good. And then if she missed this as well, just being able to eat with a feeding tube. It's not one or the other. Things can be done together.
I also feel like there's a learning curve with the feeding tube as well. Learning how to use it, how to take care of it. And what I found, at least, is we have 2 or 3 patients now in our clinic that don't like to drink water, which is opposite of the person you were talking about. Do not like to drink water. And they were starting to lose weight, weren't getting in, and they're just using their feeding tube for water. And over the past few clinics, they've slowly started, oh, I don't feel like eating, so I just threw a shake in. And I've noticed too, with patients who do make the choice to get the feeding tube earlier versus waiting to that last minute, it seems like there's a lot less stress involved around with eating family members and caregivers as well, because you're not always trying to chase nutrition, fatigue, hydration, pushing it. Because I feel like the caregivers are like, you've got to drink 6 shakes. And then the patient's like, I can't do anymore. So if you're able to kind of do it and do your Friday night fish dinner, and then supplement, I feel like it also takes the stress off the earlier you get it.
Okay, great, that's interesting. What role does saliva play when it, the way they're asking this is when it correctly stays in the mouth as opposed to drooling?
I'm not sure I fully understand, meaning just saliva in general?
It sounds like it. If there's a role sort of functionally, I guess maybe that plays instead of, the drooling process where you're losing a lot of saliva.
Saliva is definitely a good thing to have when you eat, right? The food goes in your mouth, saliva. If someone has a dry mouth, right, it's really hard. Food gets stuck and it makes it, almost like cakey if you're trying to eat. So saliva is definitely important with that. Mm-hmm. I don't know, Heather, do you have more to say on this? I'm not sure.
Saliva, what it does is it helps with moving the food around within your mouth. So that food doesn't come out, because if you have too much, it could fall out. But like Naomi said, if you don't have enough, it just sticks there. So saliva kind of works in that way to move things around, to get everything in kind of like a cohesive ball, to get it to the back of your tongue so you can get it into your throat. So when you have just enough saliva, it makes that transition from the front of your mouth to the back of your mouth with the food easier. If you have too much, it comes out, and too little, it sticks. So it's finding that balance.
Gotcha. Yeah, no, it seems like you answered his question. Thank you so much. One gentleman's asking, how invasive is the feeding tube and how does it affect quality of life?
I'm going to start with the quality of life part. And kind of piggyback on what Heather was saying before with chasing the food and nutrition, as well as family stress. So I think with quality of life, it lets you maintain your eating of whatever it is you want within a safety limit. So obviously if it's not safe for you to be eating chips, I would say avoid them. But it takes away the stress of, okay, I can only have shakes because that's what I can eat to meet my caloric needs, and I have to have all this water. And it says, okay, tonight I just want some salmon. So I'm going to eat the 3 or 4 bites that I want because I love it. And I'm going to supplement with a shake. And I think in terms of quality of life, that's a big one, because it means that you can, like I said, have your cake and eat it too. If I can eat eat what makes me happy and what's safe for me, while simultaneously getting all my nutrition and hydration without having to worry about it.
Right.
I'm going to field the invasive question to Heather. You're on mute.
The quality of life part, or the?
No, the how invasive is the procedure?
Right.
It's an outpatient. It's typically an outpatient procedure. It's local anesthesia. People go into the hospital and they can be out the next day. Mm-hmm. I've noticed I'm that person recently, because it is care and a new thing to take care of and learning. What we've started to kind of try to push, though, at our hospital, at least with our past few G2 placements, is having patients stay overnight so they can meet with a dietitian in the hospital and learn how to care for it. But usually that overnight, if it is an overnight hospital stay, it's mainly so you can learn and you're not just going home with this feeding tube and not learning how to clean it. However, piggybacking on the earlier you get it, if you get it early and you don't need it, there is a good chance that it's just an outpatient procedure and you go home the next day, because you're not using it as your main source of nutrition. You can still eat, and there's time for a nurse to come to your home to teach you how to clean with it. But the longer you wait, we may request that there is a hospital visit so that you can meet with the dietitian so that they can make sure that you and your family members know how to take care of it.
And Heather, related to that, someone else is asking, where is the feeding tube placed?
It's placed in your stomach. It's a small tube. I wish I had a picture. It's a small tube, and you can just hide it under your clothing, but it's right in your stomach, so that it's direct access to your stomach.
Gotcha. Thank you. Interesting question. I feel like my throat is more mucousy at night. I often wake up needing to cough. Any advice around that?
I'll steal that one, Naomi. More than likely, the person who asked that question, probably sleeps at night with their mouth open. So they're breathing in all the dry air. And mucus, the way that mucus moves, it has to be wet and moist. And these fibers are moving to move the mucus out. And so at night, if you're sleeping and you have this dry air come there, it's drying everything and it makes it just thicken up. So I tell patients, sleep in an angle if you can. And then also, I'm a big proponent of humidification at night as well, because then it moistens the hairs and the fibers in your throat and your mouth so that it's easier, and then that mucus doesn't get thick and globby, but more normal.
Gotcha.
Because it's wet and moist, so it's easier to move those things out.
Okay.
If that makes any sense.
I think it does, yeah. And if she has any follow-up, I'll let her ask. But
so humidification and sleep at an angle.
Okay, wonderful. Do you find that patients who have received Botox to control saliva, do you find that helps in more cases than not?
Heather's nodding on that.
I feel like it does.
I feel like it does, for sure. And I have had patients in different populations as well who say it helps, and there also could be a period of almost excess dryness they go through. But it is still better than the excessive drooling and difficulty with saliva management. But yeah, definitely have good outcomes.
Gotcha. Next question's a little interesting. I'm a caregiver for someone who's primarily in bed. Where can we learn the Heimlich maneuver for someone who's laying down most of the time?
Heather, go for it.
Hold on. Well, I would say for the Red Cross, I would go straight towards the Red Cross to I would ask them, or if there's a home health nurse.
Gotcha.
I would ask them for training on it, but the Red Cross probably would be my first choice.
Great tip. Thank you. Just to loop back quickly to the feeding tube, someone's asking what type of food is inserted through the tube.
So generally, the nutritionist would meet with the person. There's usually canned supplements so I know there's a variety of, there's organic, dairy. I know there's special formula for patients who have diabetes so that it's not too high in sugar. I know sometimes there is, and Heather, correct me if I'm wrong, almost a trial and error period. Sometimes people they try one type of nutritional supplement and it just doesn't work with their digestive tract, or for whatever reason it doesn't sit well. So, but there are different types. It is more like a canned formula.
And that's where it's really good to work with your dietitian as well, because you can also, there are some formulas that, like Naomi said, that these pre-canned formulas don't work for everybody. So if you're linked in with your dietitian, they can work with you in making your own blended formulas to get the best nutrition too. So, and those, if you have a good dietitian working with you, it also may be a cheaper option as well.
And is it difficult getting enough fiber if you use a tube? Someone's asking.
I never heard anybody complain.
So, right,
I was gonna say, because the dietitians are working with you all the time and they're measuring everything. So if you do start to have a problem, I know that like we get calls all the time like, hey, this patient has constipation or this is, and then the dietitian loops in and says, okay, I want you to add this, take out that. It's really a formula and it's an individual.
And just one extra plug there if I can.
Yeah.
It does happen sometimes. Someone starts to notice weight loss. That should, I would say, never happen if a feeding tube is in place and relied on. That would also be something to bring up to the dietitian. Because it means, like Heather said, the formula, everything is done mathematically based on weight and caloric needs. And they have a formula for that. So if weight loss is noted also, that's something that the dietitian would want to be brought in on. Okay.
And then looping back on the Botox question, any adverse effects of utilizing Botox for saliva issues?
I think Naomi had mentioned that sometimes it makes things a little too dry.
Mm-hmm. Okay.
I was going to say, that's the only thing I could really think of.
Okay. Wonderful. I don't have any more live questions. If anyone has a question, go ahead and chat it or type it into the Q&A. I'll give everybody just a minute or two here to see if we have any other questions.
I noticed somebody had put in the Q&A. I didn't see the name. They had put in an Amazon for a cup.
Yes.
Which of course I looked because I feel like I'm always looking for things. So I wanted to thank that person for sharing that. Another trick that I actually learned from a dietitian as well, because I'm always trying to look for different things as well. If you're a quick eater, a fast eater, and you're not ready to go to those adaptive equipment things, I tell people to go to Starbucks or any gas station. Those lids have a small little spout, so you can't just pour a bunch in there. So that was kind of a little trick that I learned as well from and it's a cheap kind of fix, and then nobody knows and everybody uses it, and you're not going to get that large volume in. Another thing that Naomi, if you're worried about, if you're trying to slow down, because I know with the breathing issue, there's also straws that are available out there that I learned from, our dietitian, our occupational therapist we work with, and you can sip and it only will measure out a small amount at a time. So for somebody who is thinking about that free water, doesn't want to give up that free water, those straws and those small little sippy cups are kind of the first way to kind of go, because then you're not getting that large volume and you can control it a little more.
Sure, totally makes sense. Can someone make their own shakes?
I believe so, but I think it needs to be discussed with the nutritionist. Heather had mentioned, if the formula don't sit right, if you go through different nutritional options and it doesn't sit well with your stomach or whatever, but it's not something that someone should just do at home. Like, oh, I'm going to take this meal and blend it out. Because you don't with a clogged G-tube.
Great. And we have someone who typed in and she says she just wanted to confirm that the Red Cross teaches how to do Heimlich on a prone person. She did that study, so wonderful. Thank you for letting us know that. Someone's asking, what is a toothbrush with suction? Maybe they're asking what that looks like or if it exists.
Yes. So if you have a suction at home, there are, I don't know if anyone is familiar with a what we call a toothette. It almost, it's got like a sponge on it almost. And so it attaches, there's like a suctioning attachment one. And so as you're brushing or as you're rinsing off your mouth with this toothette, the suction goes with it and it attaches. And then you brush your teeth with a suction attachment. I don't have one here.
I was trying to look one up and I can't really get a good photo. It's the product that sells it is called Sage. You would get it from a respiratory therapist. I don't know if anybody can, I don't know if you can really see it, but this bottom part connects to the suction. And so you just put your finger on this part and you're brushing your teeth. And then when the water comes in, you put your finger on that. And then there's also the little toothette that,
there you go,
that Naomi was talking about as well.
Heather, where are you finding that? Is that through Amazon or is it?
Yeah, you can go through Amazon. Okay. It's Sage Products, toothette section. I can type it in the chat. Or the Q&A.
Okay, or you can email me if there are any resources. You guys can always email me afterward. I'm happy to share it with anybody on the call who might have missed it. We have time for one last question. We have a question saying, could you give tips on swallowing liquids easier? I'm okay with food, but having issues with liquids. Kind of goes back to some of our other questions, the water and the...
Honestly, I think the thing to be doing is to probably contact the speech therapist to see if there are some maneuvers. It's hard to just say, take a small sip. I mean, you could try taking a small sip, try a straw if that lip seal is good, try one of these sippy cups, possibly what Heather mentioned about that Starbucks or that disposable lid. It's not even Starbucks, you can buy them actually at the stores. See if any of that might help. But I still think it's worth involving the speech therapist. It could be that maybe it's more problematic when you're eating, but not when you're drinking on its own, which can happen sometimes.
Okay, great. One last, super quick question. I've lost all taste and it smells like cardboard. Is that normal?
Heather, thank you for posting that. Heather, you want to field that question?
But lost, I'm sorry, I was.
It's a person who has lost all taste And it's sort of has an unusual smell from their mouth. It smells like cardboard, he's saying. Is that normal?
I would follow up with the neurologist. I have heard of taste changes, but the taste changes usually typically go towards like a more sweet or a more sour. I haven't really heard of a more bland, although that could happen maybe. I would follow up with the neurologist.
Great. Yeah, that's always a safe bet if you're wondering. Well, great. Well, we have answered all of the questions. I really want to thank Naomi, both you and Heather, for being here tonight. This was a wonderful presentation. Thanks to everybody for your important questions. It was just so great to hear and learn more. Naomi and Heather, we're so grateful to both of you for your time and your commitment to our chapter and to the ALS community. And I just want to thank everyone for joining us tonight. A big special thanks to our generous sponsor, Mitsubishi Tanabe Pharma America. We will be hosting more sessions like this in the near future, including Wednesday, July 29th at 5 p.m. with Natalie Bell from UCLA's Mindful Awareness Research Center. She'll be speaking on cultivating mindfulness and self-compassion. We can all use that these days. So if you too would like to support this type of free educational programming, please consider making a donation today to the chapter at give.alsagoldenwest.org. And please watch for this short survey on tonight's presentation that you'll receive via email in order to help us plan for future educational programs. Thank you all so much again, and have a great night.
Thank you for having us.
Thank you.
Thank you so much. Take care.